When it comes to mental health in Polk County, one agency really stands out above the rest. Comes to mind as soon as you say mental health, you think of the Peace River Center. Now recently, the Peace River Center opened up what they called their wellness clinic. And this is a very interesting combination of mental health and physical health. Here to talk to us today about the programs available at the Peace River Center Wellness Clinic is Dr. Charles Barrios. He is a psychiatrist with PRC, and we also have Karen Moore. She is the Wellness Clinic's manager. Guys, thanks for coming on today.
Thank you.
Thank you for inviting us.
Now, the Wellness Clinic, like I mentioned, well, you guys opened that up, what, about a year ago, I believe, somewhere.
1 year ago Monday.
Okay, so we almost have an anniversary here. Now, the Wellness Clinic, like I mentioned, is kind of unique because it combines mental health and physical health. Talk a little bit about the objective of Peace River Center's Wellness Clinic.
Okay. The idea across the country is for care integration. You know, like used to be you'd have one doctor, your country doctor, and he would take care of you from head to toe.
Right, right.
And then we've got specialized since then, and then everyone's care gets divided up. So most recently, you know, one doctor, a psychiatrist or therapist would take care of you from the head up, and then another primary care doctor would take care of your body. Meanwhile, this person's walking around, they're a whole person, and now at the Wellness Clinic, we're able to care for them as a whole person, and that's called integration of care, and that's primary health care and behavioral health care.
Now, when we talk about primary and behavioral health, they interact with each other, don't they? It's not a completely separate, you know, it's not this is one type of medicine, this is another type of medicine. I mean, they interact with each other very closely, don't they?
Well, psychiatry is becoming more and more integrated into medicine, not thought of as so much behavioral solely as used to be the belief, rather that there is a definite biological component, much more so than used to be understood. We're still in the infancy and probably the dark ages as far as knowing about psychiatry, but this past decade and this past 20 years, there's just been an explosion of knowledge and information regarding the brain that has validated and substantiated psychiatry as a specialty and as a true branch of medicine.
How does, as a psychiatrist, how do you go about assessing the needs of a patient when they come in?
It would depend on.
I mean, are they coming
situation.
in? Are they coming in saying, "Okay, I need counseling. I need meds for my mental health," or are they coming in? Are they telling you right off the bat, "This is what I need," or are they just coming in and saying, "Look, I have problems. Help me"?
There's different settings. There's inpatient psychiatry. There's outpatient psychiatry. I guess we'll look at it from the standpoint of the wellness clinic real quick. The wellness clinic, as an example, would be someone who is either referred by a physician or nurse practitioner within either the wellness clinic or within the community.
Okay.
Okay. Now these persons would be seen on an outpatient basis, and the chief complaint, as we call it, or the reason why they're seeking help, could be a wide spectrum of things, reasons. Okay. Sometimes it's an urgent matter and a very acute issue. Other times it's as simple as they come in and they say, "I just need a refill on my medications. I'm doing very well, thank God." And we get to know them, get a history, be certain that the medications are appropriate, renew them if that's appropriate, and so forth.
So there's an assessment, whether it be by you or by another referring doctor before really any, you know, major things are taken care of.
Absolutely, absolutely. There might be. Go ahead.
Just our patients that come to the wellness clinic, if they're new to Peace River, so they're not already
Yeah.
getting behavioral health care.
Which I'm sure you get a lot
Oh,
at
absolutely.
the wellness clinic,
Yes.
a lot of new patients.
And these patients are coming in, and we'll do a stress questionnaire. That'll
Okay.
include it's called a PHQ-9. It's asking 9 questions, which are determining whether or not they have depressive symptoms or not, or whether they have a history of trauma, or anxiety, or substance use, and then we can determine from there.
Okay.
I mean, all
so
of us
it's
are
almost like your mental health triage.
just about. I mean,
Yeah.
we're assessing people, and we have patients that'll come in, and they come in because they have a headache or a stomach problem, and then they're realizing, we ask them questions, they do the questionnaire, and then they might have been depressed their whole life, but they don't have that. That's their frame of reference. They don't know they just know they don't feel great and they're not happy, and then they answer the questions, and then we can refer them, and they can get some help.
Yeah.
From that questionnaire, we'll refer them to our on-site behavioral health counselor, and then she can assess them
Okay.
further and determine whether or not they need to be seen by a psychiatrist.
Right. When we talk about mental health, how does it affect people's daily lives? Like, I mean, obviously, there's probably a huge wide range of severities of different types of mental health, mental issues.
Absolutely.
But, I mean, with the patients that come through, is it affecting them in a severe way? Is it most of your patients are just need some help?
That would, again, depend on each situation, each person. Very often persons come in acutely very unstable, uncontrolled conditions or states. Okay, they might range from a psychotic illness, a mood condition such as bipolar disorder, either manic or depressed, an anxiety state, either generalized anxiety, obsessive compulsive anxiety, post-traumatic anxiety, panic disorder, or they might come in with some of that mixed with some substance abuse, acutely using daily, dependent, or occasionally using intoxicated,
Right.
and then having repercussions intermittently from the symptoms or drug use. Okay, and then sometimes these conditions stem from or are related to medical conditions. Okay, and that an example of that might be someone with Parkinson's disease, someone with multiple sclerosis. Okay, someone with heart disease. Okay, someone who's had strokes. Okay, as an example. But to answer your question as to how they affect persons' way of life and day-to-day living, it depends. It can be mild, it can be moderate, and it can be severe, catastrophic, such as in schizophrenia.
Let's talk a little bit about, I want to put myself in the position of someone who maybe thinks they have some type of mental health issue. How would I know that I need to get help?
Usually,
Because I mean, I'm sure a lot of folks might just think, oh, well, I'm just moody, or
Right.
or certain things just set me
We
off,
do
or
get
something
that.
like that,
We do get
But it
that
could
all
be
the
something
time.
much
Right.
more severe, right?
and kind of the rule of thumb is if it causes a problem, maybe it is a problem, and usually a family member or a friend can say, you need to see someone about that, and sometimes other people will point it out. If a person that's just generalized irritability or depression, they don't know. They don't know that they can feel better a lot of times.
Well, and I'm sure it's probably better to go and have a psychiatrist tell you, no, you're okay, that that's normal, rather than not go and let an issue that could be treated, go on and get worse. And along the lines of treatment, is there something that people can do to kind of help their symptoms?
Well, it depends on, again, the situation, the presentation, the acuity. Okay, if someone comes in a acutely uncontrolled or unstable state, you're probably looking at them needing some medication to help stabilize situation and symptoms quickly, but not just necessarily stopping there. the biopsychosocial model has always taught us, okay, look at it, both the condition as well as the treatment from a biological standpoint, a psychological standpoint, and a social standpoint. The treatment is the same. Look at it from the standpoint of biological medications, psychological with therapy and treatment, such as talk therapy, supportive therapy, cognitive behavioral therapy, and then social. Social being having healthy habits, healthy lifestyle, avoiding unhealthy habits and unhealthy lifestyle, as an example.
And that's where the wellness clinic, I think, really shines, is
Yeah.
that we can give that support. You know, we have a patient say that's depressed, and they're too depressed to feel like exercising, and then they get treatment for depression, and now they feel well enough to come to weekly health promotion education groups, and then they can lose weight. They're motivated to take care of their diabetes, where before their depression was really impacting their physical health.
Oh, wow.
Because
Absolutely.
they didn't feel well enough to participate in their own recovery.
So it's almost like I don't know, this is the way my mind works. It's almost like a nesting doll. You know, you fix the first one, and then you can pull off the layer and get to the next issue and to the next issue. So recovery becomes not just here's a prescription. Recovery becomes a process.
Absolutely, absolutely.
Yes.
It's participating in recovery, and we try to empower our patients to live the best lives they can and to be the healthiest they can.
Along the lines of what you just said, you know, someone could actually need medication and take medication, let's say for 6 months, 9 months, 2 years, and it isn't always just the medication doing the job. The person is learning how to cope, learning how to recognize, learning how to deal, gaining confidence. And over time, they may not necessarily need the medication near as much or at all. And all of a sudden are able to function. And some people can say, well, I used to need medication, now I do great without it.
What kind of, I mean, obviously the wellness clinic has a lot of, you know, we touched on, you know, the mental and the physical, but what specifically, what kind of services does the clinic actually offer?
We have a primary care ARNP, so we have a nurse practitioner and a nurse. It's a small clinic, so we're able to give really personalized service to the patients. They come in and they come back. You know, they feel it's a warm, welcoming environment, and we're trying to create a medical health home. And that's what's, you know, that's what you think of when you think about going to the doctor. You think, you know, they're going to think of the wellness clinic first, because that's where they come. They'll come to the wellness clinic and, you know, get their chronic medical condition taken care of, or, you know, acute symptoms taken care of, and then get set up for education classes, or get assistance getting hooked up with insurances. You know, our clinic was funded from the low-income pool grant, and so a lot of our patients that qualify to come to us are underinsured or uninsured, and we're trying to help them with that. We have a care manager role. It's kind of like a case manager and like a kind of a navigator, and it can help those patients get hooked up with insurances, and which is a big deal now. You know, there's a lot of people who you know, are uninsured or will be uninsured, and you know, they need assistance, and we can help guide them to a degree as to where to call and get insurance.
Now, before we wrap up here, I wanted to find out, you know, as far as appointments and walk-ins. I mean, how does your clinic work? Do you set up appointments, or do you take walk-ins, or both? Or?
Okay, both really. We prefer appointments just because it's easier to manage staff, and the patient will have less of a wait time if everyone's scheduled. But we take walk-ins. You know, we'll have a person come in and we'll work them in and make every effort to minimize their wait, and then we can assess them and then hook them up to whatever type of service they need.
Excellent. Yeah. Well, what kind of, I mean, how do they get in touch with the wellness clinic to schedule an appointment?
I can give you our number. The area code is 863. The number is 519-0930. And then for the Peace River Access to Care number is 248, same area code, 248-3311. And that, if you thought you needed mental health counseling or assessment, you could call that number, and and they could hook you up with whatever's appropriate as far as, you know, your insurance, your funding, whatever, hook you up to whatever service we could provide.
Excellent. Well, guys, thanks so much for coming on. Peace River Center, always great to have you guys on.
Thank you.
Appreciate it so much.
Keep us in the loop on everything that's going on in your field.
We will. Thank you.
Thanks.
Thank you.
The Peace River Center, their wellness clinic, taking mental health and physical health, combining the two, integrating them into one whole service that treats the entire body. It's really easy to get in touch with them. If you think for any reason that you might need help, this is completely non-judgmental. There's a stigma sometimes that goes with mental health. Forget about that. Being healthy and being well is number 1 priority. So give them a call. You can call them at 863-519-0930. You can make an appointment with them. If you need more information about Peace River Center, you can visit their website at peacerivercenter.org. The Wellness Clinic, they're open 8 a.m. to 5 p.m. Monday through Friday. They're located in Lakeland on North Gilmore Avenue at 1831 North Gilmore Avenue, right across from the Watson Clinic main campus and right around Tigertown.